Asthma is a chronic respiratory condition that affects millions of people around the world. Fortunately, there are several medications available to help manage the symptoms of asthma. In this video, we'll discuss the different classes of asthma medications and some simple mnemonics to help you remember their names and actions. Asthma is caused by a combination of genetic and environmental factors. Some of the common triggers for asthma include airborne allergens such as dust, pollen, and animal dander, irritants like smoke and pollution, respiratory infections, exercise, cold air, and certain medications. Asthma is a type 1 hypersensitivity reaction characterized by inflammation of the airways, which causes them to narrow and restrict airflow. This inflammation is caused by the release of various inflammatory mediators, including histamine, leukotrienes, and cytokines. In response to these triggers, the muscles around the airways also contract, thus increasing mucus secretion and narrowing the airways even more, causing difficulty or obstruction in breathing. The main clinical presentation of asthma includes wheezing, shortness of breath, chest tightness, and coughing, especially at night or early in the morning. Symptoms may be intermittent, with symptom-free periods alternating with exacerbations or attacks. For asthma treatment, our main goal is to dilate the airways as well as reduce inflammation in the airways. Let us begin to discuss the medications used to achieve that. The first class of asthma medications we'll talk about is bronchodilators. These medications work by relaxing the muscles in the airways, making it easier to breathe. There are two types of bronchodilators, beta agonists and anticholinergics. Beta agonists are medications that stimulate the beta-2 receptors in the lungs, causing the airways to open up. The two types of beta agonists are short-acting and long-acting. Short-acting beta agonists, or SABAs, are used for quick relief of asthma symptoms, while long-acting beta agonists, or LABAs, are used to manage asthma over the long term. A mnemonic to remember the difference between SABAs and LABAs is SABAs for sudden, LABAs for long. During a sudden acute asthma attack, SABAs save the day, while LABAs last all day, and are best used for long-term management. An example of a SABA is salbutamol, albuterol, and LABA is salmeterol. These medications end with OL. Anticholinergics, on the other hand, work by blocking the action of acetylcholine, a neurotransmitter that can cause the airways to constrict. The most common anticholinergic used in asthma treatment is ipratropium bromide. These medications end with IUM, which is also known by the brand name Atrovent. A simple mnemonic to remember ipratropium bromide is I block acetylcholine. Another one is anticholinergics, AC, chill the constricting muscle. Remember, these medications can have side effects like dry mouth and constipation. The second class of asthma medications we'll talk about is anti-inflammatory medications. These medications work by reducing inflammation in the airways, which can help prevent asthma symptoms from occurring. There are two types of anti-inflammatory medications, corticosteroids and leukotriene modifiers. Corticosteroids are medications that reduce inflammation by suppressing the immune system. They can be taken orally, inhaled, or injected, depending on the severity of asthma. A simple mnemonic to remember corticosteroids is CSI, corticosteroids stop inflammation. Examples are hydrocortisone and beclomethasone. These drugs end with 1. Leukotriene modifiers, on the other hand, work by blocking the action of leukotrienes, which are chemicals that can cause inflammation in the airways. The most common leukotriene modifier used in asthma treatment is montelukast, which is also known by the brand name Singulair. A simple mnemonic to remember montelukast is Singulair, singularly blocks leukotrienes. Remember that these drugs can cause headache and nausea. Moving on to Theophylline. This is an oral medication that can help relax the smooth muscle around the bronchioles and improve airflow. The mnemonic for Theophylline is Theo fills your lungs with air. Remember, this medication can have side effects like nausea, vomiting, and heart palpitations. Finally, there are combination medications that contain both bronchodilators and anti-inflammatory medications. These medications are often used for people with moderate to severe asthma, as they can help manage both the symptoms and underlying inflammation of the condition. One example of a combination medication is fluticasone, salmeterol, which is also known by the brand name Advair. Other medications that are not so commonly used include mast cell stabilizers like cromolyn sodium, anti-IgE antibodies like omalizumab, and antihistamines like cetrizine. That concludes our discussion on asthma pharmacology and some simple mnemonics to help remember the different types of medications. Remember, if you or someone you know has asthma, it's important to work with your healthcare provider to find the right treatment plan for you. Thank you for watching, and don't forget to subscribe for more informative videos.